Good morning. Yesterday we have just started with the orientation of the syllabus. Hello.
Good morning, sir.
Good morning. Good morning. Why there is a background noise?
Class ready?
My PPT is visible to all?
Yes, sir.
Yes, sir.
Okay. So our topic is the philosophy of nursing science and the theoretical perspectives. This is our broad topic. And yesterday we have taken the introduction of the course. And today we will discuss the study of philosophy, history of philosophy, and history and philosophy of nursing science. So everybody has learned the philosophy of nursing education during your MSCs and even in the BSCs also there are some philosophy content is there. Okay. But the philosophy of nursing science, broadly speaking, it is a overall the profession of nursing. What philosophy, as a researcher, you should follow? What is the application of the philosophy of nursing philosophy into the nursing science? Okay. So the nursing science is characterized by the two branching philosophies of the knowledge as the discipline developed. See, in all the type of research, what we are doing in the research, we are finding the new knowledge. Means the knowledge is our basis, and how that philosophy should be there for the knowledge generation, knowledge creation. Understand? So there are various terms in this learning to the philosophies. One is the empiricism and interpretive, mechanistic and holistic, quantitative and qualitative, deductive and inductive. So these are the some of the terms which are very important in studying the philosophy of nursing science. Empiricism is the dealing with the reality, the realistic observations. Means whatever you see, whatever you listen, whatever you speech is empiricism. It is based on the realistic theory. Understand? So for the empiricism, see, when the two persons are dealing, understand, maybe the employee employer, the teacher student, okay, then the teacher and the community people, teacher and the other peoples, other teachers. So whenever there is a relationship, understand. So sometime it happens that the people are talking different and thinking different. Means their speech is not relevant with their, what you can say, the hidden objectives. Understand? So that empiricism, that realistic, see, when the researcher is dealing with the participants, we have to see that you take out the realistic information. You have to take out the realistic data. Understand? It is very difficult task. So the philosophy of the nursing science is dealing with these 4-5 things. One is the empiricism, is whatever. See, the knowledge foundation cannot be based on the false ideas, false informations. It should be the realistic information. You have to go the root of the truth. What is the truth in this? Understand? For example, if you are talking about the lived experience of the mothers of their pregnancy period, understand, there might be the mixed experiences. Every mother may not have the same type of experiences. But you have to take out what is exactly the experience, and we have to put it on the paper empirically. Again, it is an empiricism. And we have to put our interpretation and interpretive. And you have to interpret whatever the observations comes from the participant, it should be the interpretive. Then mechanistic and holistic. Understand? Mechanistic is based on your interaction, based on your relationship with that. We have to develop the rapport with that, and it should be holistic. Holistic means the whole. It should be, the information should be gathered holistically. It is a what you can say, the in the 360 degrees, quantitative and qualitative, and deductive and inductive forms of science. This is all basis. It is a summary of the philosophy of nursing science. When you are dealing with the research, you are conducting the research, you should have certain principles in your mind, certain things in our mind, certain objectives in our mind. And out of that, these 5-6 elements or the components of the philosophy we should have in the mind. Okay. Then why should nurse be interested in the history and philosophy of nursing, philosophy of science? The history and philosophy of science is important as a foundation, exploring whether scientific results are actually truth. The same thing, what I told you in the empirically, history and philosophy of science is important as foundation, exploring whether scientific results are actually truth. Means whatever we are finding out, whatever we are observing, whatever we are collecting the data, whatever we are thinking of the data, then that has to be realistic. It is a truth. As nurses, our practice should be based upon the truth, and we need the ability to interpret the result of a science. Means ultimately, see, what is the science? Again, the science is a fixed nature. 1 + 2 = 3 is a science. Because science cannot be on the basis of the prediction, basis of the assumption. It is a realistic things. So the nursing science provide us with the knowledge to describe, explain, and predict outcomes. The legitimacy of any profession is built on its ability to generate and apply theory. So, if any profession, you take any profession, medical profession, nursing profession, law profession, every profession, it is based on the theories, the knowledge generation, how much faster you are generating the knowledge, more that profession will improve, more that profession will flourish. Understand? You must be knowing that the computer science has come just 10, 20 years back, but it is flourished because they have generated the knowledge. They have flourished their science, and they are now the standing top. So now, what is the importance? The importance the religion may have given to many hope for the world to come. But it is a philosophy, especially ethics, that gives us hope for this world. So there are multiple things has come in the society. There might be religion, there might be caste, there might be geography, there might be the genders, understand? But the background philosophy, which is very important, understand? So there is one link. You all are able to see and listen.
Yes, sir.
You are understanding the topic.
Yes, sir.
Yes, sir.
Yeah. So if any questions are there, you ask there and there itself. Huh?
Yes, sir.
Now you are able to see this link.
Yes, sir.
Okay. See, concept of nursing and professional organization. In this, yes. See, this Jogindra Bhatti has given the concept and meaning of the philosophy. The word philosophy literally means love of wisdom. It is a love of wisdom, and it is derived from the Greek words. Philo means love and Sophia means wisdom. Okay, so thus this is the philosophy, is the love and pursuit of wisdom. Wisdom cannot come without the knowledge. So they have divided this philosophy into the various components. That is the metaphysics. It is the study of the existence and nature of existence. Epistemology is the study of knowledge about the reality and existent and deals with the concept of knowledge. Understand? See, epistemology is a very, very complex world. Understand? Whatever you see in the newspaper, in the papers, in the books, understand, may not be a truth. Knowledge is there, but the truth is not there. So as a researcher, you have to find out whether that particular knowledge, so whatever I am reading or I am listening, it has to be a truth. So for that purpose, we must have the quality in the reading also, quality in the literature. In this, again, the ethics is the study of action, how the man should act. It means the deciding the course of action in the life. It is also called a moral philosophy. Ethics is a moral philosophy. Means what is a right and what is a wrong, what is a true and what is a false. That we have to find out. As a researcher, we have to find out. When we see why this highly elite people, highly qualified people, they immediately observes the deviation from the normal. Understand? And it requires standard of value to which all goals and actions are compared. Then the politics is the study of a force. Politics is not that politics. It tells us how the society is set up and how man should be interact in the society. Understand? Because we as a researcher, as a health researcher, we are dealing with the society. We are dealing with the human beings. We are dealing with the variations of the human beings, their diseases, their illness, their wellness, everything. And aesthetics is the study of arts, literature, music, painting, sculpture, and gives sense of life or philosophy of the art. So these are some of the branches of philosophy which we have to inculcate in our studies or in our research. So that is we have to just see. And the summary of this, the philosophy derived from the Greek word philos, means love, and Sophia means wisdom. It is a loving and searching for wisdom and truth. So the philosophy and the research is go hand in hand. The research also we are finding out the truth. The philosophy is also wisdom and the truth. Philosophy is the science of knowledge. Philosophy is the science of all sciences, and it is an unceasing effort to discern the general truth that lies behind the particular fact. Yes, so that is what the researcher need to do. Whatever you are looking, is that true? Is that what is the empirical reality that lies behind the appearance? Understand? So that we have to we identify, that we have to see into it. So that's all the philosophy. Now, is the nursing a science? Because science is a logical, systematic, and coherent way to solve the problems and answer the question. This is the science. But whether the nursing is a science, whether the nursing is a logical, systematic, and coherent way to solve the problems, yes, nursing is a science because they fit into all the criteria of the science. And what are the concerns of philosophy? And the philosophy studies concept that structure thought processes, foundation, and presumptions. Understand? So what the philosophy says, it is a nature of existence, it is morality, it is a knowledge and reason, and it is a human purpose. From what philosopher is nursing generally drawn? So how the nursing and the philosophy is go hand in hand. Whether the nursing has drawn from the philosophy or the philosophy is drawn from the nursing. That we have to discuss. So the definition in regards to the nursing, in regards to the science, which is related to the philosophy. It is intellectual and affectionate your outcome of the professional nurses. Efforts to understand the ultimate relationship among humans. So what we are in nursing, we have effort to understand the ultimate relationship among the humans, environment and health. We are having the 3 to 4 component, the human, environment, health, and nursing. And to approach nursing as a scientific discipline, to integrate a sense of values into practice, to appreciate aesthetic element that contribute to health and well-being, and to articulate a personal belief system about human being, environmental health, and nursing. So this is what a nursing is. So it's not, because nursing is very broad. As a science is broad, as a philosophy is broad, nursing is also broad, because nursing fulfills all the criteria of the philosophy, all the criteria of the science. So what we as a researcher, what we are looking at, relationship among the humans. It should be contributing to the health and well-being, and to articulate the personal belief system about human being, environmental health, and nursing. So the provision of an atmosphere of comfort while delivering care to the public they serve. So this is it is a little bit the basic of the nursing, but we must discuss, and we believe that the dignity and worth of individual must be respected and preserved. So this is the foundation of the philosophy. It is a foundation of the nursing also, and foundation of the science also. So every individual should be respected and preserved. Their rights should be preserved. And we further believe that nursing must be consistent with specifically designed to meet the needs of the patient and his family and the community in which he or she lives. So this is what the philosophy of nursing is. And philosophy is the statement of the philosophical belief regarding something. Now here, something is health and nursing. And philosophy of science in nursing explores the meaning of the truth, meaning of evidence, meaning of the life through the praxis. It is the nurse's responsibility to view science from the multitude of perspectives. As a nurse scientist, as a care providers, and from the perspective of the patient, family, and society. See, nurse scientist is not different than the care provider. Nurse scientist not separated from the professional nurse. She has to be very, very much follower of the principles of the nursing profession. So here the profession, what it says, it is a meaning of the truth. It is the evidences. We are here to develop the evidences, to create the evidences. And by creating the evidences, we are solving the problems of the patients, families, and society. If your research is not focusing on the welfare of the human beings, that is not the research. Directly or indirectly, it should serve the society. It should serve the families. It should serve the patients. Then only we will say that we are creating the knowledge or we are creating the evidences. So what are the components of the philosophies? Means to which we should focus. We should focus on the socio-economic motivations. We have to go to the grassroots level, solve the problems of the grassroots level people. Institutional and legal regimes. We have to stick to the institutional and legal regimes. We have to stick to the environmental ethics and theory of justice. So these three components, whenever we are focusing on the research, focusing on the evidences, we have to see that we are following all these principles, which are very important philosophically and ethically also. The philosophy of nursing education expresses belief regarding the teaching learning process, nursing education, and role of practical nurses prepared by the nursing faculty. So whenever we are in the education, we are giving the education to the others. We have to stick to the what processes we are following, what practical aspect we are following. So that is most important. So the example of these principles are: the health is a state of well-being that enable person to lead psychologically, socially, and economically productive life. Our focus of the health delivery should be on this. And health is a right of the people, individual, families, and communities, and have responsibility towards maintaining their health. So that this is our basis, this is our foundation, and that we should not be away from all these things. Okay, this is one example. I wanted to quote how the nurse is following the philosophy of nursing. An elderly patient has been in a trauma and appears to be crying. The nurse on admission observed that the patient has a marks on her body and believes that she has been abused. Orthopedist has viewed an X-ray and believes that the crying patient is in pain due to the fractured femur that will not require surgery, only close reduction. The chaplain observes the patient crying and believes the patient needs spiritual support. Each observation is a concept level. Okay, based on this, I wanted some input from you all. So what concept is explained in this statement, in this situation? Can anybody tell?
Sir, this is a combination of social, physical, and spiritual
Yes.
care.
Yes.
It is
Yeah. Anything else? Anything else? The nurse can find out what philosophy or what principles or what the science she should apply in this case.
she should apply a holistic care, sir.
Yes, holistic care, the spiritual care. Understand? Even the physical care also is important in this. Understand? See what the nursing philosophy tells. We have to solve the problems of the patient. We have to find out the solution. Understand? That is what the nursing philosophy also says. Understand? So here we have to observe. We have to give the support, maybe spiritual support, maybe psychological support, maybe even the physical support. I quote one example. When I was a staff nurse working in the JJ group of hospitals, I was in the night duty. And the fractured femur case was there. I admitted in my ward. And there was one assistant nurse with me. And we found out in the midnight, maybe after the midnight, 1 o'clock or 2 o'clock, the patient is scrambling. The patient is having in the pain. That my assistant nurse told that there is a SOS order of the diazepam, that is sedative. And I just asked her, can we visit the patient and we'll see before giving any medication. And I went to the patient. He was crying and he was having the pain because of his leg was not in the proper supportive position. We gave 2-3 pillows and we made him comfortable. And we have decided that we should wait for 10-15 minutes. If his pain is not subsided, then we'll give the medication. And we went for a round, and after 10-15 minutes, we again visited that patient, and patient was literally snoring, and he was in the deep sleep. This is what the nurse is, whatever the philosophy we have to see. Though it is a science, but the support of the other component, holistic, somebody told that the holistic care. See, this is what holistic care we should provide to the patient, and we should teach to our subordinate, we should teach to our students, and we should follow the philosophy of nursing. Okay. So nursing philosophies are the rationalist. Reason is the superior to the experience as the source of knowledge. So we should have the rationalization, the reason through the deduction and mathematical formula. Understand? In the research, this is what we are doing. We cannot believe on only the observation, only the based on the data. The data cannot give you the interpretation. The interpretation has to be done by the researcher. And we have to use some mathematics and the deduction. Again, empiricist, experimentation and scientific method. Again, it is also the realistic, rationalization, then the realistic and relativity. Knowledge is relative. Mind is active in knowing. Understand? So relativity is very important. So these are some of the philosophies we must follow in our research and in the development of the profession. So again, same, the rationalization. What is the philosophy of science? It is a rationalism, a positivism, empiricism, observation, testing, verification, explanation, prediction, and mathematical and deduction. This is what the philosophy of science. This is what science is. and the logical positivism dominant philosophy of science until 1950s. And the perceived view interpretive phenomenology, human science, experience, holism, understanding the meaning, pattern, feminism, and critical theory, influence of gender, culture, society, and power. Understand? So these all are very important component of science. Okay. So I think your next class is at 11:30.
Yes, sir.
Can we stop and we'll continue next day?
Sir, I have
Okay,
a
sir.
doubt.
Yes, please.
Sir, actually, I was thinking that philosophies of different philosophies when we are, what are the philosophies which are using in the nursing? I used to think that we have to incorporate realism, pragmatism, empiricism, all these things. Is it so, or the concept is different?
No. Yes, you are absolutely on the track. See,
Yes, sir.
that's what we are saying. Now, empiricism is the utmost important. That is the realistic way.
Yes, sir.
And see, nursing, see what we say, nursing is an art and nursing is a science also.
Yes, sir.
So where is the art? The art is in the emotions.
Yes, sir.
Art is in the caring. Art is in the politeness. And science is based on the empirical observations. It is a realistic ways. Understand? So we see where if the patient is admitted in the ward, okay, we know that we are following the some emotional component or holistic care, but rather than that, science is most important because medicine is a science. It is a core science. It is based on the observation, testing, experimentation, prediction, mathematical. So the nursing is a combination of art and science.
Yes, sir.
You got it?
Yes, sir.
And all these principles are applicable to the nursing. All
sir.
these principles are applicable to the research, particularly the nursing research. Got it?
Yes, sir.
Yeah. Any other question? Okay. Can we stop here?
Yes, sir.
I hope you are taking interest in the learning philosophies.
Yes, sir.
Yeah, because this is the basis for the research. It may not be directly related to this thing, but this concept there should be you should just listen to these concepts, because based on this concept you will develop a theories. You will have the theories. Various theories will be taught by Dr. Jasneet, I think so. And this is the basis. Before the theories, you should learn these philosophies.
Yes, sir.
Okay? Oh,
Yes.
thank you.
Thanks.